Hello. You may be wondering how you came to be with me today. Most people want the secret to have energy, brain power, and productivity. Most people don't sabotage their health just for the heck of it, but they don't know if what they're doing is harmful or helpful. 100% of my patients say, I want to be healthy and prevent disease for the future, but how do I go about it? Hello, I'm Dr. Alan Trites. Perhaps you've gone to your doctor or visited an alternative healthcare doctor. Do you have all the knowledge that you need to have to be healthy? Are the tests that are run, are they valid? Do you eat food, take nutrition, exercise accordingly to your genetic expression? Are you making enough energy to make it through the day? Which means, do you have enough energy at the end of the day or at the beginning of the day to exercise? Or is that exercise program detrimental to your health or beneficial? Is the clean food you pay for actually making you worse? And is the environment you live in helpful or harmful to your health? Do you want to have energy, brain power, and productivity? Well, guess what? Me too. The truth about preventing disease and symptoms such as brain fog or fatigue is in my book called Treat Yourself. And that's what you just got to, or purchase-wise, and what's going in there. So there are 3 pillars of health that goes in there, but this is a guideline. Now, in our office, we don't have to worry about guessing or not knowing. I know what I have. I know what I must do. I know what I must eat. I know how I should think and de-stress myself and what exercise I need to have to manage my health. So let me tell you a quick story about my own health and my own health journey. I've been misdiagnosed multiple times. I've been suggested exploratory surgery and medications that couldn't have worked for me because they didn't support my health or my genetics. I originally went to the doctor because my joints hurt. And my brain wasn't firing right, and worst of all, I was tired all the time. And we're not talking like, okay, you just went out and worked out and you're tired, or in the morning maybe you didn't sleep very well, you're tired. No, I couldn't get out of bed tired. At that time, I was trying to run my own business, and I needed that energy to help my patients be healthy. But I was struggling with my own health energy, and unfortunately, my family didn't support me very well at all. My spouse at the time didn't understand what was going on and why I couldn't work, and hey, these foods may be inflammatory to you, but we're going to cook for you anyway, which unfortunately made my condition worse. And so over time I was getting more and more tired, and then more frustrated, and then overwhelmed that there was nothing that can be done, because doctor after doctor would run tests and they're like, okay, there's really nothing wrong with you. And so my family and my doctors were beginning to wonder if I was making this up and there was nothing that could be done. I spent thousands of dollars and even went to the Mayo Clinic, who didn't have an answer for me. I was desperate. And then something really bad happened. I wasn't able to go to work anymore, to work as much as I wanted to support my family, because I was tired. The bottom fell out following an ugly divorce that limited my time with the children. And then I became too ill to work for the responsibilities required to help them be children. I turned away business because I didn't feel I had the energy enough to put the effort into helping other people be well, especially when I wasn't feeling well. So this meant I couldn't work the way I should have been working. And I really needed staff to help me, but I couldn't afford them either. So a typical day, a doctor goes into work and they see patients and they try to stay on time. And then they stay up late charting or taking notes or reading laboratory reports for the next day. And somewhere in there you have to read journals, and you have to take classes for continued education so you can keep informed, because things change, new information comes out. I didn't have the energy, the help, or the finances to do it all. And as you can imagine, I was in bad shape and I was desperate. But I wasn't ready to give up on my dream to help others. But how could I do this if I really couldn't help myself, and I really didn't seem to be able to find the person who could help me? So I said, self, I want to be healthy and prevent disease for the future. How in the world do I go about doing this? Because what I was doing and what I was living and the doctors I was going to just unfortunately weren't helping me along. So fast forward to the state of desperation, I took this extra time I had to learn. I took my skills that I had, and I discovered that there wasn't a magic pill, there wasn't a supplement or a medication or a diet or an exercise, or just one gene that I particularly have that was going to affect me positively or negatively. I asked myself, don't you want to have energy? Don't you want to have brain power again? Don't you want to actually be productive? If I have the energy, I have the skills to help people, but I just didn't have the energy to get there. And then, geez, if I made it past lunch and I ate something, then oh my gosh, just forget the rest of the day. So my productivity would be from like 8 to 11 and then time out. I needed more than that. So at some point, everything changed. I discovered and I figured out that it's a combination of everything. And that's what's in my book, is 3 Pillars of Health. You have to have nutrition. And based off your genes, that's the building block of health. Because even twins in your family, one person could eat tomatoes and the other person cannot. Well, how would you know that? Well, there's tests that show that. And how would you know that based on your genes? Well, there's genetic expression, because you could have all the genes over here that are really, really bad, but you're not expressing them. But how do we make sure that those don't show up? Nutrition is a major part of that. But this requires adequate testing and precise testing that general testing doesn't typically get. And so I'm going to give you some straight talk about preventing disease and most of the symptoms that walk into my office, such as fatigue and brain fog. And I need to have my brain function. So in order to make that nervous system work, it needs proper amount of oxygen and proper amount of glucose and proper amount of stimulation to keep you healthy. And without those, you can't digest properly. So you can take all the supplements you want, it's not going to go in. You can eat all the right things you want, it's not going to go in. And then the nervous system tells the immune system what to do. So how's the immune system supposed to work if it's not getting the building blocks and the nervous system's like, I don't know what's going on. I'm too tired to go into work anyway. And so when the nervous system becomes overstimulated, or the lack of glucose, or too high of glucose, or there's not enough oxygen, such as you don't breathe properly, or you have anemia so it doesn't get there, so you quickly get brain fog and memory issues. And if that keeps going, it can lead to anxiety, because it's an overstimulation of that nervous system, which then ends up breaking it down even faster. And when it gets to the point that it's not firing anymore, that's depression. So you can see all these things come along with basic chemistry, but you have to be able to digest to get there. But digestion is run by the nervous system, which requires nutrition. So there's a lot of things that go in there. So the big picture is, you can't supplement yourself out of fatigue or brain fog. You can't work yourself out of brain fog or fatigue. You can't keto or intermittent fasting or anti-inflammatory or paleo your way out of these issues. And this is why so many people fail at these diets. It's not that they're not right, it's just that maybe they're not at the right time. Or maybe their genetics don't support this particular way of eating. They need to have a different way so that it makes the most abundance of energy for them, so that it keeps the most oxygen in their body, so it keeps their blood sugar stable, so that their nervous system works and everything else goes in together. So stimulation is another way. We should stimulate by working out. Or stimulation can also be something that's emotional, or stimulation can be something that's mental. And there's various forms of exercise that we can get to do that. But which is the best for you? I discovered that genetics plays a big role in that. We have to understand what's going on with that. But that doesn't mean someone who's never been good at coordination should never do yoga, because there's part of the brain that goes in there, but there's part of stimulation. Well, what works? That's what comes to testing. So if we test in the office and we see that, hey, we do this and that's actually making this better, which means you probably don't have to eat as many of these things over here, take this many supplements. Why not do it? Because that's supporting your body. So we have to work on the first two things, such as balance and coordination and reflex time, and we have to make sure that you're eating adequate, and we have to make sure that there's no inflammatory problems that are going on that are slowing down your ability to recover and make energy. So it's all part of what's going on, and that's what we have in our 3 pillars. So I discovered in this period of being desperate that I needed to learn, and I had the tools to do it. But again, it wasn't just one supplement. It wasn't just one pill or medication. It wasn't just one exercise. It wasn't one gene. And so the bigger part of that is we discovered that if you don't look at all 3 pillars to make health work, you can make one of the biggest mistakes of your life. And it could be the most expensive mistake of your life. And so too many people read the literature and they say that, okay, well, we should have less calories, or I should work out and do this, or the doctor's plan sounds right for me. And that's the equivalent of purchasing something based off of a headline. The rest of the story is contradictory to your genes. It's contradictory to your hormones. They may not have any ability to make any energy, and worse, they can cause inflammation, and then you get worse. So, for instance, how many women do you know that eat right, exercise, hire a trainer, and yet still gain weight? Or they're fatigued, or they're actually worse off than they were. You should no pain, no gain, or you might feel worse to get better. That's not right. If you're feeling worse to get better, they are missing fundamental physiology. There is something affecting your inflammatory process. There is something affecting your blood oxygen, there's definitely something affecting your blood sugar, and maybe you're not even digesting right, so then you can't recover, and when you don't recover, then you make more lactic acid. So this little bit of workout that you did over here that you should be able to handle at 30 minutes, well, maybe at 10 minutes or whatever that goes into it, you're actually making more lactic acid than you ever should before, so you have an inflammatory response. Well, what does your body do? I'm inflamed, let's hide that into the fat, we'll burn less calories and hide it in there, and then you gain weight. And oh, by the way, there's no calories to go out, so then the oxygen goes down and the glucose goes down, then you have brain fog that goes with it, and you're tired all the time. And then what happens to your immune system? You have other things that can come up. I mean, there are people in their 20s now that have shingles. Why? They're going through this process. Or they have Epstein-Barr or some other things, and so while 95% of the world's population has Epstein-Barr, all of a sudden it's chronic in their case, and then that's another immune thing that drives everything else that we just talked about down. So it's looking at big picture. So I want to test, not guess, as we go through the process so we know exactly what's the best thing for you. It's not that these other plans, let's say keto or intermittent fasting or this functional medicine doctor over here or this alternative or this medication doesn't work. It's just the implementing of all these plans. And most doctors have one or two tools in their toolbox. You got to have it all. And you got to be able to decipher what works best for you. That's a game changer. And that's where I come in. I found out that not all tests are created equal because I've gone to all these doctors and had all these tests run for me. But what's the right test? Does it have accuracy and precision? Will it help tell me what the plan is so that we can have success for you? For instance, there are multiple genetic companies that are out there. Question is, do they test all the genes that we have to have that make energy? Do they check the ones for the immune system? Oh, do they sell your information maybe to pharmaceutical companies and then they can market to you in a different way? I don't like that. So the best company that tells you where you're from is Ancestry, but they're still missing 700 genes to see how your brain works, how you detoxify, how you make energy, how you repair, and what exercise is best for you. Those are kind of important, don't you think? So knowing what company to test for, we started understanding how to decipher results because we were getting false negatives and false positives. For instance, if you've ever had a food sensitivity test, like 95% of all companies out there do it on raw food. Do you eat raw chicken? Do you eat raw beef? And maybe you have raw asparagus, but that changes the game. So if I'm coming up for me, I was negative to all these things, and then we actually test them cooked, and I'm allergic to all of them. Well, an allergy creates massive inflammation, and then it drains all of your energy because your body has to take care of it, and then the weight doesn't come off, and then I'm trying to work out, but I'm actually fatigued because it's an allergic reaction that I'm constantly putting in my mouth, eating clean food, isn't happening. And there are so many people that are out there, and this is just one instance. It's just called an antibody test for food, but there's antibody tests for autoimmunity. There's antibody tests for heavy metals. A lot of people have hair samples taken off for heavy metal. Guess what? We're all exposed to heavy metal. That means nothing. It's not even diagnostic. I want to know what's in your body compared to that. I want to know if the body has an immune response, which would then completely hose what we call the energy system, so you don't make enough energy, so that your brain fog and fatigue are there, and then that disrupts hormone balance and everything else. That's a good test, combining all of it and looking, but unfortunately most doctors don't have the understanding in pathology and laboratory testing to get there. Why? They didn't go through that. I did. So knowing what company to test for is a big deal. That allows us to have the power to decipher your results and explain to you and customize an individual plan for you. This takes the guesswork and the frustration, and then you know exactly what to do to be and stay healthy. So again, brain fog and fatigue. Here's the big collection at the end of this. Those are parts of bigger diseases, and they can be triggers for Alzheimer's, Parkinson's, and dementia. So the average cost per year, once you get to that point of Alzheimer's, is $150,000 a year. So getting the basic understanding, this isn't 100% prevention, but it's the basis. But what if we push this out 1 year? I just gave you $150,000 in a book. So I want you to do it. But I also want you to be tested to find out, well, what else can we do to slow this down? Because it's not just about eating clean to get this there. It's about stimulation. It's about, well, what nutrients are you not getting? Because you could eat clean all you want, but the soil's changed, the environment's changed, and the nutrients that are in clean food just aren't there. And sometimes you just need a little extra. Or your body requires extra vitamin D for whatever reason. Generally speaking, it's a genetic SNP, which means that you don't absorb vitamin D the same way as everybody else, so you need a little bit more. But that's what we look at. So at least now, for me, I have all the energy I want. Of all these autoimmunities that I was diagnosed with, we have one that's even making antibodies anymore, but everything else is in remission. So I wasn't ready to give up my dream to help others. I went and I dug deep into it, and I found out exactly what was going on with me and what's my stepping plan to go through. And then I test along the way, because every 6 months your cells change. And so to have something go in, let's say, into remission and then ignore it for the rest of your life is not very efficient, and it's not very smart. In fact, it's asinine. So we do want to test, not guess. And for me, I don't have to worry about guessing, because we've been testing me along the way. I know what I have to eat. I know what I have to drink. I know how to think, and what stress balance I have to have, and what exercise I can manage. I mean, I went from very fit Iron Man to on the couch and not being able to do much of anything, and then kind of back and finding exactly what worked for me, because I knew what testing allowed me to do. And that's why I'm passionate about this. That's why I'm telling you about that. That's why I'm asking you to share this book with others, so that you can experience the dream of not having to worry about the energy, or not having to worry about, well, what's prevention, or what's coming down the road for me. But how you can do it, and how you can help yourself, and how I didn't find anybody to help me. I just did it myself. And I want to be able to share that with you and get you from point A to point B, so that you know what to do for your health. I'm Dr. Alan Trites. Be well.